Hello, my name is Ricardo León de la Fuente. I am a cardiologist from Argentina. In my talk today, I will try to answer the following question. Is a tax-based service enough for cover all necessities in Argentina health system? This is the agenda that I will develop during this talk. We will initially describe the complexity of the health system in Argentina, each of the three subsystems that make it up, then the advantage of establishing a unique tax-based system service, and to end the talk with the conclusion. Let's start with the description of the complex health system in Argentina. The population of Argentina is facing two major issues. Went from 32.6 million inhabitants in 1990 to an estimated 40.5 million in 2010. 49% are men and 51% women. Argentina presents a population structure in frank aging process. The percentage of older adults increased from 2.5% in 1895 to 3.9% in 1947 and 10% in 2010. This process is due to the confluence of several factors: the sustained decline in the fertility rate, the decrease in general mortality, and the increase in life expectancy at birth, which went from 40 years in 1947 to 75 years in 2008. Argentina's health system is made up of three sectors that are poorly integrated and also fragmented inside: the public sector, the compulsory social insurance sector, also called social works, and private sectors. Each of these systems will be described later. Who are the covered beneficiaries? As measured in the last century, the multiplication of the universal and free public offer of health services and the expansion of social security was reflected in the development of fragmented systems with three subsectors that serve three categories of users: low-income social groups, which do not have social security, salaried workers and retirees, and the population with payment capacity who buy private insurance or pay out of pocket when they are receiving care. The public sector is financed with fiscal resources, is indeed a tax-based system. The financing of national and provincial social works comes from the payment of 9% of the salary of active workers, 3% is contributed by the worker and 6% by the employer. According to the World Health Organization, between 1995 and 2008, total health expenditure as a percentage of GDP increased from 8 to 9.6%, making Argentina the Latin American country with the greatest investment in health. In 2000, Argentina had more than 17 healthcare facilities. Of these, 3,311 were hospitals, which shows a ratio of 9 hospitals per 100,000 inhabitants. Around 60% of the hospitals were private, 38% public, and the rest belonged to the social work. This shows a ratio of 4.1 beds per 1,000 inhabitants, even higher than the average of the country of the Organization for Economical Cooperation and Development, OECD, which is 3.9. Argentina is also one of the countries with the largest supply of doctors in the world, surpassed in Latin America only by Cuba and Uruguay. In 2009 and 2005, there were 3.2 doctors per 1,000 inhabitants in the country. The average in OECD countries is 3. In this graph, we see the number of hospital beds per 10,000 inhabitants in the different countries in the region, showing Argentina as one of the countries with more resources available. Rectory, the national government set the central objectives of the system through the health ministry that fulfill the function of leadership and establish the political direction. The health ministry as well is responsible for the function of standardization, regulation, planning, and evaluation of the health action carried out in the national territory. I will describe now the three subsystems. The public sector is made up of provincial and national ministerial administrative structures and the network of hospitals and public health centers that provide free care to anyone who demands it. In general, people without social security and without payment capacity, approximately 14.6 million people in 2008. The compulsory social insurance sector is organized around social works, which cover salaried workers and their family according to branch of activities. In addition, each province has an social works that cover public employees in each jurisdiction. The private sector includes professionals who provide independent services to private patients associated with the specific social works or private prepaid medicine system. Healthcare establishments also contracted by the social works and voluntary insurance entities called company of prepaid medicine. In this graph, we can see the distribution of the three subsystems. 37% of the population with the lowest resource fall to the attention of the public system financed, mainly through taxes. The social security system comprises just over half of the population and covers those who have formal jobs and their families. It is financed, like I mentioned before, from the contribution of 3% of the employees' salaries and 6% by the employer. As expressed by K. Market in the journal Medicos, here is also reflect some of the main inequity of our health system. 33% of the most unprotected population with lower resources depend on 27% of the financing, and 13% of the population, mainly urban and related to the formal work, is provided with health services with 16% of the expenditure. With the fall in the formal employment in our country, the great economic recession, and the strong devaluation of our currency, inequities in our health system were further increased. That is why I propose to establish a unique model of health system that is inclusive and can guarantee a universal health system with free access to the entire population at all points of health care. We will describe the main characteristics of health system, their quality and affordability, and based on these two principles, provide quality in the medical services offered that can be reflected in higher indicator of public health. One of the main advantages of this system is to be able to guarantee equality in access to health system for the entire population, avoiding the different type of selection and also being inclusive. According to the information provided by the OECD, tax-based system turned out to be more convenient and affordable, as we can see in the following graph. The health expenditure in Argentina in percentage of GDP, according to data from World Bank, is around 10% and are higher than the average in the Latin American region. Despite the higher expenditure on health, our country does not reflect the best life expectancy in the region. Another high indicator of quality in medical services is infant mortality, which, as we can see, is not the lowest in the region and is surpassed by countries as Chile and Colombia with lower health expenditure. So in conclusion, the health system in Argentina shows a high degree of fragmentation and inequality. With relatively high health expenditure, they fail to provide quality medical services. Establishing a single health tax-based system could mean improving the entire public health system, representing fewer costs and achieving better quality in public health. Thank you very much for your attention.